Dylan.
Shiloh.
Mark. Peter.
Abby.
Maddie.
ADHD, or Attention Deficit Hyperactivity Disorder, is a behavioral condition that results in the inability to focus, as well as other devastating psychological, emotional, or even physical effects. In 2001, 12-year-old Alex McCartney was brave enough to share his story about living with ADHD. According to Frontline from PBS, Alex constantly felt tired, depressed, reluctant to complete simple chores, to interact with his parents, or even go to school. Similar to many young children, Alex desired to have caring friends to interact with and share his feelings with. However, the other young boys at Alex's school preferred to be rather rowdy and even mean to Alex, making fun of his weight. Alex, who happened to be over 200 pounds at the time, soon found that his weight continued to increase as his signs of depression increased as well. His school grades were declining, and Alex admitted to himself and to others that he saw no purpose for himself in the world. While at the peak of his struggles, Alex tried to commit suicide. Luckily for the young boy, his attempt was unsuccessful, and his parents began to actively seek help for their child. After being put on the medication of Adderall, Alex's grades finally began to improve. He saw himself having a desire to succeed in life, and most importantly, his physical health started to increase. In this situation, it is clear that medication was the answer to saving the life of this young boy. However, in many other ADHD cases, anti-medication approaches have been more effective and successful for other people and children. From every single ADHD case, one thing is certain: a solution must be found to help individuals, children and adults alike, cope with their disorder. Throughout this discussion, my goal is to describe ADHD and its history, explain how this condition affects people of all ages, and finally, the benefits and downfalls of taking behavioral medications. Attention Deficit Hyperactivity Disorder is a common mental condition that affects both children and adults all across the world. In 2016, according to CHADD, or Children and Adults with Attention Deficit Hyperactivity Disorder, approximately 9.5% of children ages 2 to 17 have ever been diagnosed with ADHD. The number of people suffering from ADHD has not always been so high. This is partly due to the fact that, according to the American Psychiatric Association, ADHD was not even formally recognized until the late 1960s. However, this condition has traced back to the late 18th century. According to Dr. Vincent Anali from Very Well Mind, children who suffered from ADHD in the early 1900s were thought to have issues with moral control. Likewise, medicines such as Benzedrine, which was thought to cure everything from headaches to Parkinson's disease, this medicine was one of the only behavioral treatments available thought to cure these moral conditions of these children and adults. In fact, there was such a lack of knowledge of ADHD in the 20th century that there was not even a formal name for the disease until the late 1960s. Children and adults alike with this condition will be referred to as having a brain injury, organic brain disease, or even hyperkinetic impulse disorder before the name ADHD was established. Although once recognized as a disease, doctors and medical professionals were able to further study and understand the essence of the condition ADHD. Attention Deficit Hyperactivity Disorder affects different areas of the brain, and the result is the struggle or inability to retain concentration or focus for long periods of time. As explained by the Child Developmental Institute, specific chemicals are necessary in the brain to carry a nerve impulse along structures called neural pathways. When a transmitter is not available or not functioning correctly, a message may be not carried out efficiently, causing this loss of thought or loss of focus that ADHD patients experience. According to Healthline newspaper, the impairment of a neural pathway can cause one of 3 diagnoses of ADHD. The first type is inattentive type. This form of ADHD affects an individual by making it more difficult to pay attention to details or required tasks of the person. Likewise, this person will usually be distracted and they easily dislike tasks that call for prolonged mental activity or extended focus. This would be the type of ADHD that repeatedly causes a person to forget their personal items or a task or errand that they had to run during the day. The second type of ADHD is hyperactive/impulse. This category of the condition causes an individual to develop a fidgeting manner, to talk too much, or feel the need to be consistently or constantly active throughout the day. Many of the common behavioral issues associated with this type of ADHD are related to this second type, because a person will constantly feel that they must speak, move, or, like I mentioned, engage in an activity, either theirs or someone else's. The final type of ADHD is a combination of both the inattentive and the hyperactive type. In this case, an individual would exhibit behaviors that are not consistent with only one category. Instead, a person with this category, the third category of the condition, would feel as though they must always be active, but they may struggle with finding that motivation to be active. Also, they may struggle with self-motivation or maintaining long-term focus or even forgetfulness as well. It is important that a person knows which type of ADHD they suffer from, because this will allow them to better cope with these side effects and may help when deciding to medicate themselves or to not medicate themselves. For any person, it is beneficial to understand the specific category of ADHD they, a friend, or a loved one may suffer from. Realizing that this attention disorder is a real medical condition that affects millions of people is the first step in finding a solution. Many people feel that medication is an answer to attention deficit hyperactivity disorder. However, many others strongly support the anti-medication approach for both adults and children alike. Research from Centers for Disease Control and Prevention reports that 62% of children ages 2 to 17 with ADHD were taking medication as a treatment. These statistics shows that there is not an overwhelming majority decision to rely on stimulants or medication to suppress the effects of the attention disorder. Instead, many parents or individuals feel that the medication will cause negative side effects such as weight gain or depression or even suicide, especially for younger children. To elaborate, many people choose to depend on alternate treatments for ADHD, including simply getting more sleep at night or more exercise during the day or picking up meditation. A person could even choose to develop a behavioral treatment plan with a supervisor or a friend to award them when they successfully complete a task without losing their train of focus or when they maintain an activity for an extended period of time. Both the medication and anti-medication approach have been supported by some doctors and discredited by others. However, many medical professionals collectively agree that a treatment plan should be specific to an individual in order to combat the effects of ADHD. In conclusion, having an attention disorder can be intimidating or frightening information to discover. Despite needing to adjust everyday life to accommodate with this condition, many people have found peace and happiness while living with ADHD. Obtaining correct and useful knowledge about attention deficit hyperactivity disorder is a vital part in overcoming the title of an individual who is struggling with a disease. With the correct information, it is completely possible to establish a treatment plan, whether or not it involves medication, that allows a person to experience living without the effects of ADHD. Thank you.
Why did you choose this topic?
I chose this topic because I feel that ADHD is a serious disease, and I feel that a lot more children and adults struggle with ADHD than the public realizes, and I feel that along those lines there would be more public support if this disease was made known to more people.
Do you know somebody with ADHD? What is their treatment plan?
I do know people with ADHD. Many kids from my high school, even in my own classes, suffer from ADHD. Since I know some of these people personally, I know that they choose to take medication to help themselves focus in class, and that seems to be beneficial to them, but I also know a few that choose to not medicate themselves, which seems to work just as efficiently as well. Yes?
Do the majority of doctors support medicating people with ADHD
After researching this disease very thoroughly, I know that the amount of doctors who recommend taking medication is roughly the exact same amount as doctors who do not recommend medication. So no, I would not say the numbers are different. I would say the pro-medication, anti-medication doctors are roughly the same. Yes.
Is there a cure for ADHD? Like, is there any way to completely get rid of it?
Sadly, as of today medicine, there is no cure that can completely get rid of ADHD in a person's life. However, as I mentioned throughout this speech, there are many different ways to combat the effects of ADHD and live a completely normal life with this condition. One can only hope that in the near future that a cure for ADHD will be found. Thank you.